So what are natural supplements that can help? So the food is the most important thing, and always think, can I get everything from food rather than go for a supplement? Because that's the most natural way it exists and the most effective way. But sometimes turmeric, trying to get turmeric in food in enough amount to give you pain relief sometimes may be too bitter, overpowering for taste, and may not be so pleasant. So sometimes we need to get turmeric or curcumin, the active compound, in a supplement. Now, some people should not be on turmeric, like people who are pregnant, people in the middle of a bile duct obstruction, and people who are on blood thinners. Just be mindful. It's not for everyone. But we've seen very good evidence, and in our practice, we're seeing people feel better on turmeric supplements, whether it's for osteoarthritis, rheumatoid, inflammation. And there's some studies of its benefit in like lupus and other inflammatory conditions. And then they're looking at turmeric as a cancer-fighting benefit, preventing or reversing colon polyps, and so many other brain health, so many other health benefits. So if you just want to do it for natural health, you can add the turmeric spice. Make sure there's black pepper when you add turmeric to have it more bioavailable. Just add it to whatever food you're cooking. If you add it in small amounts, like 1/4 to half a teaspoon, it's not going to be overpowering in your dish. Boswellia has been also featured as helpful for arthritis. Unfortunately, Boswellia, bromelain, we don't have enough studies. We don't have FDA approval for that. So, what's the dose? Is it safe? It's up to the person. I wouldn't go to the shop just seeking Boswellia today just because you have arthritis. But just these are options. They're there. They're out there. So, for example, as far as I'm concerned with bromelain, I'd rather eat the pineapple, put it in my smoothie, or eat it or consume it as a fruit than actually take bromelain, for example. Omega-3 can come from the plant-based foods that we talked about. Most people know omega-3 as fish oil. Well, the fish has to eat the algae in the sea to get omega-3. So we can get the omega-3 directly from the algae source, and that's the active DHA and EPA, or we can get the ALA form of omega-3 from like flaxseed, ground flaxseed. So flaxseed has to be ground for us to be absorbing it. So flax meal, chia seeds, hemp seeds, walnuts, and others. Dark green leafy vegetables have a lot of omega-3. When we eat them in large amounts, we notice that. So people have probably heard of glucosamine chondroitin sulfate or MSM and all that. The studies are back and forth with that. There's no strong evidence that they work. So usually I tell my patients, if they like to try it, they want to give it about 2 months trial. If they feel benefit and they're not having side effects, I'm not opposing to that. But if there's no benefit at all, I wouldn't waste your time being on it.